So, hi.
Hello.
So, how would you like to introduce yourself?
So my name is Tammy Nyden. I'm a professor of philosophy. I teach at Grinnell College, and I specialize in early modern philosophy, particularly Spinoza, and now I've been moving into epistemic justice, as we're going to talk about, and some other work related to our activism together, and our teaching, as we'll talk about, has done that as well. What about you? How would you like to introduce yourself?
I'm Dionne Bensonsmith, and I am a professor of, I think, public policy, gender, race, and feminist theory. And I teach between the Claremont colleges. So I teach at Claremont McKenna College, and I also teach at Claremont Graduate University. And I teach classes in applied gender studies. I teach classes in government and in public policy. So in my study, what I study is Black feminist thought, Black feminist epistemologies, and I'm going to talk a little bit about my activism and how the activism and classroom work blend together and work with one another.
Great. So I should just acknowledge, first of all, this is awkward. I'm not used to being on camera in this kind of way, so it's a little weird. And we wanted to say this is not a filter. It seems like a filter. As my hair goes across my face from the wind, you'll sort of see it's not.
Well, I think it's a good time to address activism.
Are we?
Exactly.
Yeah.
So when we talk about activism and scholarly work, right now we're at Asilomar Conference Center. We just got finished doing a presentation for CMANCY, which stands for California Mental Health Youth and Child and Youth Alliance, or something like that. Is it?
Yeah, Child Advocacy and Youth. Yeah, we have it backwards now. So,
yeah.
But in any case, it's for children's mental health advocacy. And the people that were here at this conference and who we spoke to range from caregivers, youth themselves, people working at the county level, city level, state level, service delivery.
Yeah, private healthcare service delivery and public health service delivery.
People working on legislative activism and advocacy.
Yeah. And we were here presenting on children's mental health justice. So. Which is a justice framework that definitely we should talk about a little bit, and it comes directly or stems directly from our work in the classroom, and then also our work as scholars.
That's right. So we're going to try to have a little conversation to talk about our journey and how we brought together our scholarship, our teaching, our activism. And so I thought we'd just begin with how did you get involved in activism?
How I got involved in activism, and we were talking about this. So I've always been a person, and I've always been involved with things, but the event that really kicked off my focus, particularly on social justice activism, and not just the usual, I volunteered with literacy campaigns. I would do stuff with public policy and do this sort of institutional reform work. Was the death of one of my best friends from college. So in 1998, 99, my best friend from college was killed by the San Diego police in, a case where, like many black men, he was accused of breaking into actually a friend's apartment. And this was a case that was just so unreal on a lot of levels. This is before, obviously, George Floyd. This was before, a lot of the police killings that, Philando Castile. And this was a time where, we went to college together. And one of the things that I was raised to believe, and he was raised to believe, and we were all raised to believe, was this idea that if you got a good education, and if you, behaved well, like the politics of respectability, and you were respectable, that this wouldn't happen. And it completely shifted my reality. And it shifted my reality in such a strong way that it really shifted me from studying traditional political science I was studying Congress, and I always tell my graduate students, I was deep into a dissertation on filibuster, and I can tell you a lot about the filibuster. It's just like, I can talk about the filibuster for days. So I was deep, waist deep in a dissertation, and it was going to be a good one too. I'd already been at plenty of political science conferences talking about filibuster and how filibuster is used in social policy. And I stopped it. I couldn't write the dissertation, and I wanted to do something that was more that spoke to what I was going through. And that was when I was introduced to Patricia Hill Collins's Black Feminist Thought, and that started this journey that moved me to melding what I was learning, right, and what I do as a scholar and how I even present myself with my experiences to the main thing in Hill Collins and Black Feminist Thought is really theorizing from experience.
Exactly.
And so once I started theorizing, I started working and reflecting on my own experiences as a Black woman, as a Black woman who is tall, Black, and a feminist in the United States. It completely changed then the type of scholarship that I would pursue and how I would even present myself and how I would teach. So how about you?
Yeah, it's interesting because, we were talking about this earlier. I think there's a moment for me similar to that where I sort of moved from doing reform or just sort of being a change maker within systems in a certain way to really starting to look at changing systems themselves. And even that started with a kind of reformist reform kind of position where, before this, I was, doing the academic thing, making changes in the college in terms of getting an ombuds because, working on social justice in the kind of academic context issue. But it really wasn't until my son really started having difficulties and it was clear he had serious mental illness at a very young age and that we were unable to get services for him no matter what. Like, you have this idea that if you do everything right. If you come from a respectable family, so there's respectability politics, there's so much of that in the mental health sphere in a different way, right? And so that was interesting because even if you do everything right, you try to get your child help and so forth, you can't. It doesn't matter where you're at within the system. If there aren't the appropriate services available, especially for young children with serious mental illness. And so that was sort of shocking, and I first started getting involved at the state level in Iowa and locally just to try to change systems, but from within the system, right, working on state boards and advisory committees and so forth, and just like doing rallies at the State House to change legislation and things like that. But as I continued to be on those boards, they were traumatizing themselves, so that you have this great pain of seeing your child suffer. You have this great difficulty of not being able to get the services for them. You live in a culture that really, from every angle, you're internalizing mother blame and it's being thrown at you, right? Because very differently, my son also has kidney problems, and the way his kidney issues were treated in surgery and so forth, very different than the ways mental health hospitalizations were treated, though they were both just as life-threatening, right? And so navigating all that and realizing that lived experience got to the point that this isn't a problem of just lack of resources and we need more money. This is a problem about how our narratives are set up. The reason we don't have money where we need it, the resources where we need it, is because of how everything's framed.
Right.
And that became a moment when we started Mothers on the Front Line, and I moved from really focusing on trying to reform elements of the system with what I naively thought was a broken system.
Well, I remember that because I remember before we started Mothers on the Front Line, and you had come to me and you said, hey, you want to work with me on reforming some public policy? And I had told you I'm over it.
Yes.
I'm not, I don't want to go lobby at a state house. I don't want to talk to, you're like, no, I think, if we can get this children's mental health waiver and some other things, and we can talk to the right people. And I was like, okay, I'll listen and I'll give you pointers, but I'm not going to I don't want to start an organization that focuses on policy, right? I wanted to do something that was that really worked on the ground level, and I was like, okay, just give you a while. And I remember hanging up, and I'm like, okay, she'll come back.
And I did.
Yeah.
Not calmly either.
Yeah, no.
It was
no.
like, can't do this anymore. This is awful. And this is where the philosophy part comes into it, not only because now it's really working from a position of feeling and seeing problems from lived experience and understanding that the system's not broken, the system's doing exactly what it's intended to do, and the whole system needs to be changed fundamentally.
Right.
But also sitting at those meetings and doing high-level policy on a state level. We were actually at that point, we were actually trying to imagine a whole new state agency that was integrated. So this is like, also it was philosophically interesting from a systems point of view, like what would this look like? But after working on it for years and being in these conversations, it was so clear there were just some fundamental philosophical assumptions in all of these discussions that were highly problematic.
Mm-hmm.
And it was not only like stigmatized narratives at this level that people think then all these organizations are doing anti-stigma campaigns because if we just talk about it, if people were just aware, it would be better. That's not true at all.
Mm-hmm.
Because it's not that people aren't aware of problems, it's that the deep stigma has a philosophical history and a grounding
mm-hmm.
in epistemologies, in ontologies, particularly these very individualistic that feed into this neoliberal framework that we talk about. So there are all these elements that became clear they have to be disrupted. And in a way that became the big question. And I think we began our conversations, how do we survive this? How do we get through? How do we get our child what they need? How do I do the hermeneutical gymnastics?
Right.
To when I'm speaking to providers and so forth, to get them to focus on what they need to focus on.
Mm-hmm.
And so we didn't know at the time we were doing epistemic justice work.
Mm-hmm.
That was the language we were using. But we were using story work. We knew we were doing narrative change. We were doing script change. But it was really, as we started looking into that more and more as scholars, we started really thinking about this in terms of epistemic injustice and so on. So it took a few years in, I think, to Mothers in the Front Line, till we really started connecting it to that work directly, although we were talking about it for a while. Yeah.
I mean, and I'm not a philosopher, so I'm going to use some of these words wrong.
Yes.
But I know that getting to the point where in not just the work that we do outside of the classroom, but inside of the classroom, when we actually get to the underlying, I think it's ontology, right?
Yeah.
So the underlying ontology, which is gets to, Audre Lorde's, and I talk about this. My class we read it almost every intro to FGSS, which is feminism and gender and sexuality studies class. And we talked about the master's tools and the whole historical context, and then the way in which the quote's been misused, rehashed. But it for us in policy, what I see it as, and also in pedagogy, and also in terms of disruptive theorizing. And what activism does, which is to create these new narrative and conceptual lanes that we can then start to actually talk about and do things differently, or even think about how to do things differently. One of the things that we had always talked about is getting away from just rearranging the furniture in the house. And this goes back to the master's tools, but really reconstructing and visualizing what the house would be and visualizing the next. And so I guess one of the questions is that I think would be important to answer or even to talk about it, or what are the theories that, or even scholars and philosophers that have informed the lenses, and then what kinds of lenses? I mean, you have one lens, and now you've changed dramatically the lens through which you look at systems, you look at behavior, and you actually even look at intent, and that includes your own child. Yeah. So if you could talk a little bit about that would be interesting.
So, when you work in a discipline, philosophy, place, you don't turn that part of you off when you're doing other work. So as I'm sitting at a policy table, I can't turn off the scholar of philosophy. I can't stop thinking about Spinoza because that's what I work on and I think about. And so as I'm listening to people talk about children, all of their behavior is being constructed as willful behavior, as choice. And it's very Cartesian in the way it's set up. And because my previous work was very much on how Spinoza, denies not only the mind-body dualism, but this will-intellect distinction. And this idea that a cognition is completely separate and a different thing from an affect, right? That they're really, in the same way that mind and body are two different sides of the same thing, so are affect and cognition. And then how that mirrors, a lot of things that are in contemporary neuroscience and so forth. And as I'm sitting there and listening to this, and one of the things my son has, among other conditions, is Tourette's syndrome. So free will is something we think about a lot in my house. Okay, when his body moves, his brain has thoughts, his mind has thoughts, his he cannot control things that most people take for granted that they can control. It really gets you to start thinking about what do we mean when we say people are making choices or not making choices, and so on. And that's when the Spinoza stuff comes out. The other place where it often comes out is this idea of how we treat individuals as these social atoms, whether it's the therapist only thinks of the one child as their patient, and so they don't care about how something is affecting the siblings, the parents, the caregivers, the child, how the child is functioning within the context of the school or so forth. It's all very much looking at as though we're all these just individual minds and brains that are somehow disconnected from each other. So that's one of the places where the philosophy and the frameworks that I came with from studying Spinoza, right, I would start making connections, which I know seem very far-fetched to everyone at the time and now. But what I was really working towards is thinking about relational autonomy instead of thinking about autonomy as independence, because as we work on disability justice issues, for instance, and talking about how everyone's interdependent on each other, the idea that someone is dependent on someone else is not a flaw, that is a human condition. And when people have the privilege to have their dependence on others erased, that is often in an oppressive environment. And so these are the kind of things that where these ideas get connected. So that's one of the lenses. A feminist lens really became very important because of the amount of caregiver exploitation that occurs in this work. So as I started to work on this, it wasn't just about getting a full continuum of decarcerated care. That's a whole other issue we're going to have to talk about for children's mental health, but also about a care infrastructure and the fact that, and then this is where I think, now I am teaching in gender and women's studies. We've sort of been converging on each other's disciplines over time. It's interesting because she's teaching philosophy in our classes. Don't tell her.
Thank you, Linda Alcoff.
Thank you, Linda Alcoff. This is exactly, yes. So talk about that a little bit.
Oh.
Which is hilarious.
So when we first met at Grinnell College, so we were at Grinnell College together, and Linda Alcoff was on my dissertation committee and is largely responsible for, because I definitely wasn't learning feminist theory or even critical race theory, maybe a little bit of it. We had a couple professors, like one professor in political science, but most of what I learned in graduate school, I learned from Linda, and immensely grateful for it. And so my entry into philosophy came from Alcoff, and I assumed that feminist epistemology and feminist philosophy was just part of philosophy. And so I think when I met you and you were talking about Spinoza, and relationality, right?
Yes.
And I don't know what you said, but I was like, oh, this is like feminist philosophy and the way in which, we need to situate ourselves and, that we're not in a binary, right?
Yes.
So the way that feminist epistemology in particular resists and disrupts the notion of either or. And I said, right. And you went, I don't know what you're talking about.
So there were years we were having this sort of parallel conversation, because we're good friends before all this happened, where we started doing this work together,
right.
and so there was a sort of parallel conversation where we kept sort of being like, yeah, that sounds right, but I don't know the literatures you're talking about, I don't know the literatures you're talking about, and then we would start sharing more and more, and so that was sort of an interesting thing how that came together.
And it came together right at a time that I moved into teaching methods.
Yes.
And one of the things, and I think methods and methodology, at least for me as a scholar, and as an activist scholar and practitioner, it's around methodology that really, that in the IRB, which we can talk about too.
Yeah.
But in terms of looking at research methods and the way in which we approach research questions, that is, I think, one of the areas where the blending between theory, particularly feminist theories and Black feminist theories, I would even say a lot of decolonial theorizing come to play. And that was where I had to encounter, and not just me, but my students had to encounter the philosophy door. And this is where was actually your wheelhouse, because
that's what I knew.
Philosophy of science, and a lot of what feminist methods do is to start to deconstruct the way in which it but it really challenges ontologies that come from positivism. And so that was when we really, because I was like, I need help. I'm supposed to teach this class, and I'm supposed to develop this class, which now is a great class. But I remember I was reading, I think it was Charlene Hesse-Bieber, and I was also reading just early, like I had to go all the way back to Sandra Harding.
Right.
And I was reading feminist philosophers who were talking about philosophy of science.
And that was where we started coming together, because I teach philosophy of science. We were doing feminist philosophy of science in my classes. We were talking about it. And that was when we really started talking about positionality, about standpoint. And as friends, so as colleagues we're talking about that, but as friends going through some of these issues with our children, we also started filtering into those conversations about how we were just talked to at the doctor's office, how we're being, things are being framed for us. I mean, another big piece of it, I think, where this came together for me is my work on the history of philosophy has always been contextual. Mm-hmm. And all of the ways I've interpreted texts have to do with looking at the historical context, looking at the chronology of the text of the writer themselves, looking at the social embeddedness of the thought.
Right.
And so when we would be talking about methods, that would sort of come together in the conversation. So one of the things that those lenses, I think, come together when the work we're doing now, I mean, I think about what we just did here, mm-hmm. right? We're presenting to people who, most of which really want practical answers. In fact, we had someone in our audience for our workshop here, they have an issue they have a parent they need to talk to and give an answer to because the system isn't serving them well. And they were really sort of puzzled at what to do. And for us, it seemed like a very simple thing. And we said, just don't gaslight them. Right. And so we talked about gaslighting in our presentation and how there's structural gaslighting that's occurring in the systems where we're being told. So for instance, we're being told that the problem is the navigation of the system. The caregiver's not navigating the system properly, so we're going to provide you with family navigators to help. We're not going to provide you with any more services. So when there's like service reform, like there's reform in the system, in the state I live in, Iowa, it's mostly been in terms of adding more navigators but not adding more services, right. which is a type of institutional gaslighting because it's telling you that the problem is the individual The individual mother, usually caregiver, is not navigating the system properly, when really it's a structural and systemic issue of there are not the services in the first place.
Right.
But we're going to make you think and be confused that it's your problem and your misunderstanding and confusion about the system, when really what we're doing is we're erasing the fact that the structure is not providing the care it says it is and is legally required to do so.
I want you, because I think it's important to go a little bit deeper into that, because this is, to me, the turn in justice work.
Yes.
In praxis and in practice, right?
Yes.
And so much of our justice movements, and this, I also have to say that I benefit largely around 10, 11 years ago, I started doing work, and I started working with reproductive justice organizers. And one of the things that reproductive justice, and I was working this out also as a scholar, right? I hate that term, scholar. I was working this out in my teaching and in my research, because at that point I was doing research on, again, theorizing from experience. I had fibroids, and I was doing research on Black women's decision making around reproductive health. And one of the things that I was quickly introduced to and quickly saw is that there was a tension between reproductive rights and the way in which we understand reproductive rights is all these matters of choice and agency that are assumed even within the reproductive rights, not only movement, but within reproductive rights literature and reproductive rights theory. And that there were, 93 is when, the founding mothers in the RJ movement really introduced this RJ framework, the reproductive justice framework, which is, revolutionary in its theory and praxis, because it takes that focus off of individual agency. And it understands individual agency as nested within community and within structure. And as an institutionalist, which is what I'm trained as a political scientist, we're always institutionalists in political science. The institutions really structure our behaviors. And we are taught to believe in activism. We're taught, and a lot of times in the rhetoric in the classroom, that just takes one, right? So individuals change institutions. Individuals we respond to incentives, we respond to the community and community constraints, and so our decisions are constrained within that context. And what RJ does is it recognizes agency as not being independent of context, right? So
and happening in community with others.
And happening in community with others, and also that our reproductive justice in that last tenet is the right to make decisions, right? Autonomous decisions on behalf of yourself and behalf of your community. And so that means it links with all of these other, so you can't make healthy or your decisions to have a child or not to have a child, to parent, not to parent, is really contextualized by a lot of factors, and your ability to make healthy decisions and to raise your children in an environment that, and I think this is where it looped in for you, the ability and your right to raise a child in the environment where they have access to clean water, clean air, food, non-exploitive labor, that's necessarily dependent upon this entire sort of community. And so the way in which that kind of RJ has influenced not only how I understand when you were talking about rights and autonomy, right? And it could have blew that up for me as a political scientist, but the way in which it also started to link into other movements and other decisions and other ways in which children are raised. So the Children's Mental Health Justice Framework and Stigmatized Motherhood. And so this is the sort of conversation and the track of the conversation. But you were going to say something.
No, I think there's several things of that. I mean, one of it is there's sort of under a kind of just a rights framework as opposed to a justice framework, there often is this idea of sort of social atomism and sort of social atoms competing, whether it's Hobbesian or Lockean, right? There's sort of this kind of notion. And when those early conversations about Spinoza and these other various philosophical traditions, what was interesting is the relationality and the idea that as I started to say conatus is collective, right?
Right.
So like Spinoza says there's nothing better for humans than other humans because humans work together because they share certain natures to work together.
Right.
And this gets to sort of the idea of like community, how communities work together to achieve a certain effect, right?
Right.
So same thing with families. Like, so when you think about how a child is doing, you can only think about that in terms of the context of their family, their community, their school, how those relationships are happening. And that kind of that relationality, that agency is understood not in terms of independence from, but rather agency is more understood as activity, ability to do, and that ability to do is often much better. It is always better and more enhanced when it's collaborative and it's shared and it's in community. And that's very different than the rights framework, which is about, can you have the freedom to do something as an individual or be prevented from harming others as these individual units?
Yeah, the negative and positive.
The negative and positive freedoms
Yeah.
is very different than thinking about working together in such a way that all the parties are being active, working from their own nature, as opposed to being thrown around by external forces.
So in that way, I mean, I think it as you were talking, I was thinking, how does that work out in the classroom? Because what we're talking about you're highlighting, and I think the work that we have moved to do and the work that we're doing, in the Children's Mental Health Justice Framework, which it really puts an emphasis on relationality.
Yeah.
It puts an emphasis on reciprocity, right? A collaboration as opposed to being competition based.
Yes.
And so all of these things also for me, and I'm wondering for you, have had, I guess, they've also become present, and that they are present in my teaching.
Yes.
So this has changed. Not only the theory has not influenced, which was actually the other way around. So the activism influenced the theory.
Yes.
And it pushed me deeper into Black feminist theorizing, collective theorizing, indigenous and decolonial theorizing, and things that really pushed my focus on systems and collaboration. And then in turn, now that had a radical change, much more recent than the other work on my teaching. So I'm just wondering how
I think it's
reciprocity and relationality play out in your teaching.
It's interesting because it's not only in terms of the content of the classes, which for both of us has changed very much as we've been doing this work, but the way we teach, the pedagogy has completely changed. And it's not only even the pedagogy in the classroom, but the relationship of the classroom to the community. So one of the things that the first class I did that related to the activism and advocacy that we do is in 2017 I taught a course on children's mental health policy and outreach. And that was actually really motivated from the fact that when I was doing advocacy, more the reformist approach, you needed to have stories to get the legislators to listen to you. You need to live from your personal lived experience, but you also needed data stories. Like you needed to have that kind of authority for them to listen to you about the solutions. For them to believe you about the problems, it had to be your experience. For them to believe you about the solutions, you had to have good data stories.
Right.
I mean, basically is how it went. So that class, the idea of that class was let's teach students some practical skills and how to do digital storytelling, as well as get a little bit of experience in the concept of story work, very much influenced by Joanne Archibald. And so I started off there with just that idea of what would that look like. But it very much changed into working on a school-to-prison pipeline project with team teaching and so on. Where that relates to your question is not only have those courses and my other courses involve a different kind of experience. I'm not teaching you something. I'm not emptying ideas into your head. I'm not using the Socratic method to try to bring you to where I am what I'm thinking right now, what I'm assuming we all know and I'm uncovering in some kind of way. But rather, the classroom is an environment where everyone is bringing something of value to be shared, and the alchemical mix of that is going to be something new.
Right.
And to facilitate as opposed to teach, to facilitate the space. And so that is something that has changed in the pedagogy. But as both of those courses had these components of students were producing things that were in working with activists. Activists came in the first class more traditional reformist advocates, and the second class activists were coming in the school to prison pipeline class, and we were working with the students were producing things that activists could use in the field, right? And what became important about relationality there is it cannot be extractive. It cannot be that the community members, the activists come in and they just do something that's a benefit pedagogically for our students, and then they go away without anything. The students are producing something. We as a class are doing something to help contribute and become part of that community, to contribute to that story and so forth, as well as to receive that story and so on. So I think reciprocity became important pedagogically in both senses, because that involved a lot of work, because the academy is very extractive of the objects of study it has in communities. And so, and you can talk about the IRB work here, because one of the things we really had to work on is thinking about how our communities going to be participants in this classroom space, and we're going to be participants in the community. And we're not going to have this kind of understanding of one group somehow extracting something from another group because they knew better what to do with that knowledge.
Right.
But understanding that that wisdom is a reciprocal gift.
Yeah. And so, for me, there's a number of ways in which this has really impacted my teaching, in both at the graduate level and at the undergraduate level. The process of, and I think this is, because I've also, I had to teach the class in feminist methodologies. And one of the things that is a central tenet for feminist researchers, and people are really going to research from the feminist lens, in addition to asking some questions that really have to do with social justice and really are focused on systems, is decentering the researcher. And so the process of decentering the researcher's voice and the methods that you need to employ as a researcher to decenter your voice and to decenter your central question, which is really, it can't be more antithetical and opposite of the training that I got as a political scientist, requires, critical reflexivity. It requires you to really, first of all, situate yourself. So standpoint theory is really important here, and to really start to theorize and work through what your standpoint is, but reflexivity. And so during these exercises and reflexive exercises and reflexive prompts to really require my graduate students, and then as I started to critically engage, one of the things that then you start to do is, as you move yourself out, then the engagement with your research participants and engagement with research participants to ask questions, to bring up things that are important to them in the research process becomes, there's more space for that.
Yes.
And so you asked about the IRB, which is still in development, but, I had the community-based, is one of the only community-based IRBs. I think it's the only one situated in the reproductive justice community. And aside from the traditional role of an IRB, which is the review research, and even in that, we've had to review and change just the way in which we approach reviewing research, and the way in which I'm working with a software program right now, an Axiom Mentor, and changing the questions so that the questions are more reflective of not only community practitioners, because the purpose of this IRB is not just to partner traditional researchers at academic institutions, private, like pharmaceutical institutions, people with PhDs, but to really actually engage and to nurture the capacity of community groups and community organizations to produce their own research, right? And to do that means that, and it has, weekly, it means that we really have to start thinking through a lot of not only the assumptions that we make in terms of positivism, but even the assumptions that we make in terms of institutional researchers in training, right? And the types of questions that are really important to us as researchers, particularly as academic researchers, are not necessarily the questions that are important to the communities in which we depend on doing research. In our case, it would be Black women, right? And then how we then write that research up, and then how we communicate it. And that's the second part of what you're talking about with extraction, right? That is not in keeping with the social justice practice. And the social justice practice of research is that the research that we do, particularly on communities, and I think it's the Bronx research collective that has, a lot of people use this term though, like no research about us without us.
Yes.
And so, I've seen it in several different places. Right. Yeah.
Right.
Yeah. And it's not just no research about us without us, which is to say that we should be informing the research questions, but I think it needs to go even further than that. That once the research is done, the research is processed, and the research is communicated, it has to be communicated
from it too.
right, and it has to be given back to the community, and it has to be given back to the community in a way that the community can benefit from it, and the communities can grow from it. And so that's really, in the nutshell, I think the central like the nugget, right, of the goal of the IRB.
And what is so important about that, and how it relates to the Mothers in the Frontline work that we do, how it relates to the scholarship, how it relates to the way we teach, how the way we bring them all together, is that, and this becomes one of the philosophical pieces, is the underlying ontology. One of the reasons, as you guys are writing the new IRB ethics training, it's tough. Yeah. And we were talking about, and she would like, we would be talking, and you're like, oh, this, and I'm like, yeah, because you are actually coming up with a completely different framework that is stepping away from a neo-Kantian framework of thinking about the autonomy of individuals and treating individuals as an ends rather than a means as the main framework. Whereas when you're thinking about means and ends, first of all, you're thinking about transactional between social atoms. You're talking about the well-being of community as the highest ethical goal, and as the well-being of people, individuals always being embedded within communities and families and so forth. And that becomes a reason you have to have a whole new ethic. And so you can talk about things like ethics of care. Right. You can bring in these kind of things to now form a whole new IRB. So one of the reasons we wanted to do this in this way, instead of presenting a paper and doing a panel, which we sometimes do, but for this, is because this is the very methodology itself. This is sharing our personality, this is positionality, sharing the story, how we get here, but you can see how it all starts to come together. Right?
I think the other thing, and in the time that we have left, because I did ask it, I realized that we did the academic thing too, pedagogy, and pedagogy is hard to talk about because pedagogy is something that we don't usually think about, and we're not encouraged to think about. But one of the pedagogical activist, like social justice principles, and even the research principles that we're working on is collaboration, right? And so the ways in which collaboration and collaboratory work, right, that knowledge is not created by single atoms. My knowledge is not created singularly by me, but my knowledge is created and is a byproduct of my interaction with you, right? And through that interaction with one another, relationality with one another, that's how we're actually creating these new spaces, and we're creating new theoretical frameworks. So, in the spirit of collaboration and not competition, what are some of the things that like your go-to pedagogical practices within the classroom, or even our go-to practices within workshops and facilitation? Like, what are the ones that you would like to highlight for folks?
Yeah, I think one of the things we used here as well, we often use liberating structures, which are freely available online. If you look them up, there are many different things. You can use them in the classroom, you can use them in committee work, you can use them to facilitate workshops and all sorts of things, which are ways to bring groups together to gather knowledge in a non-hierarchical way.
Mm-hmm.
And so that's one of the things that we do. I think one of the things that becomes important, and I think I go back to what we did here and what bringing this sort of full circle, when this person who works from a county is saying, how do I work with this parent, and we're saying, well, don't gaslight them. One of the important things that came out is it is not your job to defend a broken system.
Mm-hmm.
Right? It's not your job to defend a broken system. And so if you don't gaslight the parent, if you focus on it's not the parent's fault, it's not your fault as an individual working in the system, there is a structural problem here, and we together can acknowledge that, and we can together can talk about how to disrupt that.
Right.
That was a very practical solution for a person on the ground doing this work every day.
Mm-hmm.
But that came from theory and scholarship that often is extremely esoteric, right?
Mm-hmm.
We do even sneak in, terms like epistemic injustice in these conversations. Yeah. We do bring theory here in a very applied setting among non-scholars, and we talk about it, but we break it down into what does that mean for your practice? Right. What are you going to do? So using liberating structures to give people a place where they can talk about how their positionality affects how they treat their patients,
mm-hmm.
how their patient's positionality affects how they're going to hear what they tell their patients, and how they're going to express
mm-hmm.
themselves to the providers. These things come together in these kind of ways.
Yeah.
What about you? What are some of the tensions? Right, so you have been on this journey. You have your teaching, your scholarship, your activism have all just gone deeper and deeper and transformed over the years.
Mm-hmm.
But have you experienced any tensions between these these methodologies, these approaches in the academy, outside the academy when you're trying to bring theory in? Like, what kind of tensions have you experienced along the way?
Well, some of the tensions. I mean, one of the central tensions is the devaluing of collaboratory work,
yes, yeah.
right, and true collaboratory work, right. And so there's always this pushback if you're doing work and like who gets first authorship, where are you in the process and how you claim credit,
yeah.
And so especially for me, because I also work on the margins. I'm most of the time I'm visiting as a faculty member, or sometimes I'm an adjunct, and so that is an issue. It's an issue from the standpoint of when I am the primary, but it's also the issue when I'm in the marginalized position, because I don't want people. I need to have some way, right, of being accredited. And if people are not working in a more liberatory, collaborative framework, then what often happens for folks like me is that people are actually extracting a lot of my experience, my knowledge, by just saying, well, can we just talk about this? Can we have lunch? I just want to pick your brain. And by picking your brain, it's really, I'm doing work. And it's work that is not recognized. And so I have to walk that line with myself between that extractive level of people, what is it called? Epistemic exploitation.
Yes.
And the forms of epistemic exploitation that happen, particularly with faculty members, and then Black faculty members and Black women faculty members. And then in the classroom, I mean, it's taken me a very long time to be brave enough in the classroom to break the traditional ways in which we're getting student participation, which is discussion and then grading, like things like grading discussion. I don't grade discussion, and I've had to really learn how to lean into front loading and explaining to the students what the secret sauce is. Like, this is what we're doing, and this is the type of pedagogical process that we're going to be engaging in together. And every semester I'm nervous. And it'll happen again next semester, because I start with bell hooks, I start with liberating structures. We may read Adrienne Marie Brown, and they're always like, wait, this is a class, this is a social policy class, and we're in week 3, and we haven't gotten to any real social, what they would say, real social policy. And so that's a tension, and it's scary because I don't have tenure. And so my lifeblood as a teacher, not so much anymore at the graduate, well, still at the graduate level, but a lot less. But at the undergraduate level, is dependent upon how I'm evaluated and whether or not they think that they're learning. And that's where actually requiring them to do reflexive activities, both as a social justice work in the classroom, but just doing different things that are not just exams, but requiring them to say what I've learned, what I've come into this space, what I want to get, what did I get out of this unit, and then talking and dyading together has really helped me. And that comes directly out of workshop work and movement space work. So the things that we do in movement space to really get everyone on the same page, so that we're all then going to work collectively on a social justice issue. I've started to bring that. When I bring that into the classroom and we start there, and then we pick up quote unquote real social policy, they're all they're in the same space, and their minds are in the same sort of structural or destructurized space, so that they don't come back and go, you know what, I don't understand why or what we're doing, right?
No, I think that for me, a lot of the tension has to do with what gets labeled what discipline and how that affects the structure of the college and where things get put. And so in some of these interdisciplinary classes that I taught, I would be bringing philosophy to students who were avoiding the major because they just saw it as not relevant to the issues they were concerned with, racial justice, feminism, so forth, because they were the way they were being presented with philosophy, they were seeing it in a very kind of positivistic way and so forth. And so they were sort of shocked when we started talking about epistemic injustice, when we started talking about, let's problematize notions of punishment and think about punitive systems. Let's think about what care is. What does it mean to have an abolitionist framework? And what does that mean in terms of the genealogy of stigma? How did stigma come about? Why is stigma and punitive systems go together? How do we look at that and understand it? Those students now start taking philosophy classes who never would before.
Right.
But in my philosophy classes, and often would have to explain to colleagues and so forth, why is this philosophy?
Right.
Whereas we're going to conferences with people who've never studied philosophy, who aren't interested in it, that's not why they're here, and we're talking about issues like will and intellect and epistemologies and ontologies, and we're having these conversations, although we're often making sure to use some different language.
But they're actually going to philosophy, and they want to know more, and going to even, I mean, I've had some of the best conversations about government, political science, governing. I mean, we just had a whole conversation about redlining and citizenship. And I haven't had a conversation with colleagues about citizenship and the way in which, you know, citizenship is constructed and the role of public policy in really constructing how we experience our lives as citizens. And so that
at
kind
a
of
meal at the conference
at a
with
meal at
government
the
officials who are working in these roles that are applied. Exactly.
And so it was, I mean, the defunding of schools and the de-resourcing of schools as an issue of citizenship, right? Mm-hmm. And so this is a theory out of government, and this is a theory out of political science, like citizenship theory, sociology and political science. And so I'll take that conversation back to the students. I'll take that conversation even back to my work. So in the time that we have left, if you had to name 3 to 5 authors, theories, or practices, or name a little bit of a mix of both, what would you recommend for folks to pick up and read or try and do or go and see?
I would say certainly try the liberating structures in your classroom and so forth. If you one of the things I would point out, sort of, this isn't exactly your question, but I think it's important, is that there's often this discussion of public philosophy or being an academic scholar as a philosopher and so forth. And often people think that simply means taking your scholarship and sharing it with the public, like making it understandable to them. And one of the things we've been talking about, why we're doing it this way, what we're talking about is the content in the academy has to be informed by people with real lived experience. Mm-hmm. This isn't something that we're doing for the outside world and making available to them. It is a mutual conversation that is happening. And so I think that change in mindset, that public philosophy is applying philosophy in public spaces mm-hmm. with the public in public activity. That's a very different view of public philosophy than I'm going to write an article in the New York Times so that the public can understand this concept. Right. Which is also important, but it's not the same thing. So that's one thing I'd say is I think we need to start rethinking what we mean by public philosophy and what we mean by philosophy and activism, what we mean by scholarship and activism. So that's one thing. I think that there's a lot of great work that does bring together these kind of things in the area of epistemic injustice. For instance, Christy Dotson has been really important to our work. Mm-hmm. It's if you look at all of her work, what's so impressive about it is it's not only the philosophical theory, which is there and is tight, but it's also the shared lived experience, the breaking down, this is my experience as an academic, mm-hmm. and treating that as itself worthy of scholarly pursuit. I think these are some of the things that we need to sort of rethink mm-hmm. in how we talk about what public philosophy is. It's not a separation of public practice and from the actual theory. Yeah.
So if I had to say one book for teaching,
what would it be?
It would be Bell Hooks' Teaching to Transgress, or teaching for democracy or something like that. Yes. So but either one. So definitely one book, and you could follow that book from the beginning, from the opening chapters on everyone doing a writing practice and everyone writing at the beginning of class, all the way through to really how to decenter your voice and decenter your position within the classroom. Definitely, I guess for your folks, you already mentioned Christy Dotson's work in epistemic injustice. I would say, if I had to talk about one theory, right, and really look at Patricia Hill Collins's standpoint theory, a Black feminist standpoint theory, and really looking at feminist methodologies, right, and the way in which even the work of Allison Jaeger, Patricia Hill Collins. Like, if you only had one person to read in this, just read like 50 Things by Patricia Hill Collins. Dorothy Roberts' Killing the Black Body, if you want to really understand how to break down these sort of concepts of agency and what you would call relational autonomy, but institutions and institutional agency and personal choice theory. Those would be, I think, the top books. Mm-hmm. And I think that in terms of influencing teaching and what you can do to develop this conversation with students, because I think the other thing that really I can't underscore enough is that changing the pedagogy and the pedagogy in the classroom needs to happen in conversation with the students. And the students need to be participating in the pedagogical practices and the structures that are going on in the classroom from the very beginning, so that it's everyone's collective space. And Adrienne Marie Brown's Emergent Strategies book is really, really good for a couple of chapters out of there. And it doesn't matter. I know people are using it in math classes. Just as a touch point to start the conversation on breaking down the sort of hierarchical structures that underpin a lot of what I would consider like the other side, and not the social justice kind of practices and decentering. So that would be my recommendation.
That's very good. And along those lines, like having the students help build the rubrics.
Mm-hmm.
What is it you want to learn here? What do you think is evidence that you've learned it? How do I observe that? How do you show that to me? So no, I think that's right. So I think as we finish this conversation, one of the things that has been interesting is you work with undergraduates, you work with graduate students. This has been collaborative between you and I forever. We collaborate on our teaching. We, I don't think a semester has gone by that we don't speak to each other's classes.
Right.
We have students talking to each other across institutions. What do you think when we think about the role philosophy is playing in the world, in these areas and so forth? The discipline of philosophy in academia can be very narrowly prescribed,
mm-hmm.
right, by academia itself. But one of the things that has struck me in all the work that we've done is this has fundamentally been philosophic work.
Mm-hmm.
And by looking at various ways of knowing, by looking at different ontological understandings, by looking and questioning and being critical of very foundational foundations of ethical theories and how it applies to very practical things, like for this speaker, this person in the audience, shifting the conversation from it being about you as an individual, the parent as an individual, to being structural.
Right.
Right. From your conversation about talking about the classroom being a collaborative space,
mm-hmm.
that's an ontological shift.
Mm-hmm.
And so I think that's where philosophers, maybe we need to get better about helping communicate what our discipline has to offer in these spaces, and actually stepping up and doing it.
Yeah.
Yeah. So
thank you.
We are really looking forward to our conversation in May, and any questions that you have for us and about our work, and
anything that you have to offer us too.
Exactly.
So, yes.
Okay. Thank you.